This is One on One. We are pleased to be joined by Robert Davison, who is CEO, Mental Health Association of Essex and Morris County, and also Michele Walsh, Program Director, Mental Health Association of Essex County's PATH program, which stands for?
Projects for Assistance in Transition from Homelessness.
Okay, let's talk about this. You're primarily concerned about people who are dealing with homelessness, right? What's the connection between homelessness and mental health issues? Talk about it.
Yeah, I think we can find that most people that are suffering from homelessness, specifically chronic homelessness, which means someone's been homeless for a year or more and they have a disability, that disability is normally mental illness. So we're talking about schizophrenia, bipolar disorder, major depression, the major mental illnesses. And so it's not as much that the homelessness came first, maybe the mental illness came first and it was untreated. And, you know, through years of going through the system and maybe the system failing them, they then become homeless and then chronically homeless.
How does this program help people, PATH program?
It houses people. You know, it starts with going out to meet the people where they are, looking them in the eye, asking them how they're doing, building a relationship, and housing them. Just from November 30th of last year, Michele and her team have managed to house 30 people, 30 individuals with severe and persistent mental illness that have been homeless for more than a year.
Where do you find them?
Everywhere.
Be specific.
I think the thing I've found most since November, since the PATH program started, is that we're finding a lot of people in the township of Montclair. You know,
My hometown, our hometown. Seriously?
Absolutely.
Yeah, definitely.
Where?
And we're talking about people that grew up in Montclair. You know, and maybe they have a substance abuse problem and they're not talking with their family, and so they lost that housing opportunity. Or maybe they have severe and persistent mental illness and their family may not understand that mental illness and be able to support them anymore.
Steve, we've gone out and engaged people everywhere from along the riverbanks of the Passaic River in Fairfield to the riverbanks of the Passaic River in Newark and everywhere in between. So it's not just an urban issue.
How responsive are, again, everyone has their own situation, but you were also at Penn Station. You spent some time in Penn Station, right, working there, and there are a lot of folks, those of us who travel through Penn Station, we know there are people who are dealing with homelessness. By and large, how responsive are people to coming in, getting help, accepting help?
Yeah, I think, especially when I went to Penn Station to work and do homeless outreach, I was very nervous that people wouldn't be receptive to me, that I looked very different than them maybe, that I didn't experience the things that they were experiencing. But they were really open. The majority of people want to get help. They don't want to be homeless. They don't want to not have access to showers or shelter. There's so many barriers, especially when you have a mental illness, to getting up from homelessness and back being housed, that, you know, when they see someone that genuinely wants to work with them and genuinely, you know, they can tell that I'm looking you in the eye, that I'm offering you a coffee and I'm sitting down and drinking it with you.
About trust.
Yeah,
and
definitely.
accept it.
And, you know, Michelle's being modest. Working with individuals that are homeless as a result of mental illness is difficult. It takes a long time to build a relationship. It takes charisma and persistence. And Michele and her staff have it, and they have it on a daily basis.
But are there more men, women, what?
It's nationally and in New Jersey and in Essex County, it's about 60 to 65% men.
60, 65% men?
Yes, yeah.
Veterans, any unique special issues? We're going to be doing a whole range of veterans-related programs actually supported in large part by the Healthcare Foundation in New Jersey, organization you know well, committed to finding out what services are out there for veterans. Is there a direct correlation between veterans and homelessness?
I think so. We're especially seeing young veterans.
Having a harder time connecting, finding their place?
And connecting with people. Veterans, I would say, is the hardest population to connect. Homeless veterans are very difficult to connect with. They may not yet be accepting of the services. They don't want to accept that there may be a mental health issue.
Steve, these are typically men that have had 3 or 4 tours of duty in combat. That's astounding.
They just keep going back.
Yeah, and the human brain wasn't meant to withstand that type of assault.
You actually dealt with a former judge who was homeless.
Yeah. So he's, you know, I first found him at Penn Station. Huh. And he was abusing substances. Every day he was drinking. And the police had gone from a good relationship, a joking relationship with him, to that his substance abuse became so severe that he just became verbally abusive. And so we kind of played this game where he would drink a lot, drink too much, injure himself, go to the hospital, and he would disappear for a little while, and we would try to engage while he was there, but he didn't want it. He would come back and do the same thing, and so after doing that a while, he finally kind of accepted. You know, he still has not accepted the mental health part of it, but he accepted it enough to help us get him from there.
Where is he today?
So he was placed in our permanent supportive housing, and he was successfully living there. But because of his substance abuse, you know, this is kind of an example of how it doesn't always work out right.
Yeah.
But now he's getting care in a nursing home, and you know, he does have a house.
Bob, let me ask you this: the whole question of stigma. What do you think most people's attitudes are about those dealing with mental health issues? And in fact, do you think it's changing in any significant way?
You know, I've been in the field for 30 years, and I think the stigma is diminishing. 30 years ago, we wouldn't be doing this show. You know, your predecessor would not have done this show. However, having said that, stigma is still significant. And a lot of people still fail to seek treatment because of the stigma, because of the shame base of mental illnesses, which isn't backed up by the science. You know, mental illness, particularly schizophrenia, is biological in nature. It's a medical disorder.
But the question of who cares about this, the folks at Partners for Health that we talked about before, them, other foundations who are committed to this, but there's not a huge corporate, no disrespect to the corporate community, but you don't sense a lot of corporations saying, yeah, I want to get behind mental health programming. I want to be supportive of it. Where is the support for this? And government, it's all a question about what government's role is going to be in terms of dealing with those mental health issues. Am I complicating it too much?
No, I mean, part of our work is building that support. You know, if you had a family member that tragically came down with a heart issue, someone would send over a casserole.
That's right.
If one of your family members came down with major depression, there'd be no casserole. So we're trying to build that support and normalize mental illnesses as biological illnesses, just like hypertension, diabetes, anything else.
Is it public awareness more than anything else?
I think it's public awareness and it's comfort.
What do you mean comfort?
So, you know, when it happens to you or in your family, you become more comfortable with that. This is, like Bob said, it normalizes it.
Before I let you out of here, Tony's Kitchen Initiative, tell me something about it.
Oh, that's a wonderful program funded by the Partners for Health. They've been very proactive. They funded us to provide a case manager, where one of our case managers goes right to Tony's Kitchen in Montclair. That's a food pantry. Oh, it's a great organization. The staff there couldn't be more proactive, and we're able to work directly with individuals with mental illness and directly with individuals that are homeless, including them referring them to Michele's program, who has subsequently housed some of them.
You bring services right to them where they are and right in the community.
That's the most important part, yeah.
What do you mean?
To just go to the person and not expecting people to come up to your office.
They're not coming to you.
Yeah,
They're
no,
not coming.
definitely not.
Yeah. Well, listen, and by the way, particularly because you're talking about my hometown in Montclair that we know very well, it just strikes me, and I'm born and raised in Newark, you're talking about Penn Station, we can't look away. We can't afford to look away. These people have given too much to our society, and you're helping them every day, and I want to thank you for being with us and helping to tell an important story. Well done.
Thank you.
Thank you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by ADP, Partners for Health Foundation, the Healthcare Foundation of New Jersey, New Jersey Sharing Network, Holy Name Medical Center in Teaneck, New Jersey, Kessler Foundation, and by the law firm of Gibbons, P.C. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.